Kabarole Church Missionary Hospital, which is Uganda's second oldest missionary hospital in the country, after Mengo Hospital was established in 1903 by Ashton Bond. According to the facilities director, Dr. Mugyisha Edward, the hospital fell out from the benefits it used to enjoy as a church missionary hospital following changes in government leadership in the 1970s.
There's been a lot of links that have fallen out of place. The support that we used to enjoy from the Church Missionary Society dwindled, and of course even a couple of other challenges, including wars, sometimes even poor management in the past. The hospital has continued to face a lot of challenges.
Dr. Mugyisha says that the poor state of the infrastructure has brought about a limitation on installation of some equipment.
Poor infrastructure affects the kind of equipment we can actually install. Poor infrastructure affects the kind of specialists that we can attract to the hospital. Poor infrastructure also affects the kind of patients we can be able to take care of. So one of the biggest challenges, infrastructure.
In August last year, the Toro Kingdom Prime Minister by then, Bernard Tungako Atenyi, called for support to private non-profit hospitals by government to effectively carry out their services to the population. The call was for the second time made by the Kingdom's Minister for General Duties in the Office of the Prime Minister, James Mugenyi.
Have come like Ebola, recently we were hit by COVID. The King's subjects suffer a lot if amidst them there is no better health facilities. Fine, we have the regional referral hospital, but we have people who still think of going for private services. Now this one is a private, not for profit making. As a kingdom, we request the government, central government, and other donor agencies, all well-wishers, to come in to rescue in some situations. If there could be a budget specific for PNFPs, private, not for profit making, it would make a great improvement. So I implore the government of the Republic of Uganda and our friend, His Excellency Yoweri Kaguta Museveni, to take it personal as he develops other social infrastructures, roads and the like. Let him also think specifically about Kabarole Hospital.
As a general hospital, we are running on the bare minimum requirements of a general hospital. We definitely fulfill the requirements of a general hospitals. We are able to take care of emergency operations, cesarean sections, laparotomies, operations to save life. But as a key player in the health sector in this region, we should be able to roll out a wide range of specialist services that many of us clients seek from Kampala and of Lake Mbarara. And which are these services?
Dr. Mugyisha highlights that due to limited support of the facility, they are not able to have specialists.
We also face, that is also because of a limited resource envelope, is the issue of a high staff turnover. Now, because we don't have a lot of support in terms of finances, we are able to attract very many skilled people in all departments, nurses, doctors, but the turnover is very high. So one day you have an excellent midwife, an excellent nurse, and because you're not paying them well enough, they'll work for you for 3 months and they are gone. So we also need support from government in terms of seconding staff. It is very possible for government to actually recruit staff, put them on their payroll, since now they're paying well, and then second them to us. Me myself, I was actually seconded for Ministry of Health. So that's why I've actually been able to be a bit consistent in this region for a while. And if you look at the records prior to me coming in, most of the directors here would stay for sometimes even less than a year because of poor pay. But because of the government support, I've been able to stay here for almost now 3 years.
Last year, Kabarole Hospital launched a campaign of 2.7 billion shillings for the establishment of an oxygen production plant and to set up an intensive care unit. The Omukama of Toro Oyonyimba Kavambai Guru Rokedi IV officially launched a fundraising campaign calling upon people of goodwill to support the initiative. However, the Rwenzori Diocese, which oversees the facility, says that the support of the campaign has not yielded results as they had anticipated.
Well, the King was here to launch this project. We thank the online church that has contributed something so far to this cause. But please tell the King that we have not done enough mobilization really to help us to achieve this dream. So I pray that the Kingdom will put in more effort, mobilizing for this equipment that we want to buy here as a unit that is established for the good of the people here.
We keep failing to meet up with the rising cost of drugs, sundries, and even now of late fuel. In 2019, a litre of diesel was going for about 2,800. But right now, it's 6,000 something. So you can imagine, if we put on that generator, we are running at 3 times the amount we used to spend.
The leader appeals to government to support the facility